A new development for people with diabetes that could help prevent some of the terrible consequences of the disease.
It's a tiny monitor that continuously reads a diabetic's blood sugar. CBS 2's Dr. Max Gomez is here with more right now. Doc, how are you?
That's right. This is really interesting. Now, for most diabetics, knowing your blood sugar so you know how much insulin to take means pricking your finger a dozen or more times a day. And even then, it's tough to keep blood sugar under control. Well, how about something that's not much bigger than a flash drive that talks to your smartphone and your doctor? Prominsky is a classically trained professional ballerina, but a few years ago she started developing some typical symptoms of type 1 diabetes.
Going to the bathroom 5 times an hour, just huge bladder. It interfered with my life. I had to leave. I was in a ballet company at the time. I had to leave ballet class in order to go to the bathroom. In the middle of the night, I was starving. I was losing tons of weight.
A blood test revealed sky-high blood sugar. Caitlin was diabetic. She had to retire from ballet, but today she's back dancing professionally with the national tour of Dirty Dancing. That's really hard to do because a 2-hour performance burns a lot of blood sugar. Part of what's let her do that is this tiny device, a continuous glucose monitor, CGM for short.
That lets the patient look at their blood sugar in real time, and that's the most amazing thing I've seen in my 20-something years of practice.
Diabetes specialist Dr. Stuart Weiss says recent studies have shown that CGMs actually help type 1 diabetics keep tighter control of their blood sugar. Caitlin uses a Dexcom CGM that not only monitors her blood sugar, it transmits her numbers to her smartphone and tells her how her sugar is trending.
It would be scary if it was going straight down, or even scarier if it was 2 arrows going straight down. That means I'm really fallen.
Too low a blood sugar can be fatal. The Dexcom device alerts the diabetic of that, and just as importantly,
those alerts and alarms can be communicated to their parents or their spouse, and someone can intervene and help them as well. Patients live a much fuller life.
Now, the Dexcom device is the only CGM approved by the FDA to allow diabetics to forego finger sticks. And as small as a Dexcom device is, they're working to make it as small as a penny so that no one needs to know if you're diabetic.
Well, you can barely see it now, but I'm sure that technology is right around the corner.
Even tinier. And some people then now use an insulin pump that kind of regulates how much, but the continuous monitor is what really makes a difference because they now know what they need to take.
Yeah.
They say there's an app for that. It's nice that there is an app.
Exactly.
Really
there is.
Thanks, Dr. Max.
You bet.